First of all, I want to thank the parish for allowing you to be able to come out here and answer our questions. I want to thank you for taking our questions. I have three quick points I'd like to make. First addresses taxes in health care, and I'm not sure if there's any taxes, federal, state, local charge, but is there a way, if there is, that we can immediately remove all taxes out of health care, which would have an effect on the cost of health care immediately, by the way. Secondly, any reasonable discussion or bill that comes out of Congress has to include some level of tort reform so that we can lower the cost for doctors to be able to operate. And my third point I'd like to make is if any bill is passed and signed by this current president, would that include all members of Congress and the president on that plan?
Well, now we're talking skins and shirts, okay? First, I'll say regarding taxes, this administration is not talking about lowering taxes, it's talking about raising taxes. That's number one. Secondly, regarding tort reform, this Congress is being dominated by the left of the left, and they're not going to advocate tort reform. There has to be a sweet spot where if somebody is an unfortunate victim of malpractice, he or she is able to get that paid for. We need that. At the same time, removing the incentive for defensive medicine that may contribute 10 to 20% of our health care cost. And so that is not in any of these Democratic proposals. The Republicans offered amendment after amendment in committee, and they were voted down on party line vote, party line vote, party line vote. Again, that's not us Democrats, Independents, Republicans, because I think we're of like mind. I'm speaking up there, skins versus shirts. And lastly, Republicans also offered an amendment that this would apply to Congress, and it got rejected on a party line vote. I agree with your concern, Mr. Olim. Absolutely. Melissa?
Hi, I'm Sandy. Thank you for coming here. We appreciate it. Mine's more of a question of some kind of clarity. What is exactly a czar? How are they appointed? What is their background check? I mean, like, are they clearanced? And I've never really heard of this since this administration. So, I mean, have they been in previous administrations? And that's why, that's my question. So I'd appreciate an answer.
The czar, if you will, or the czarina, has been used by previous presidents and has typically been a very limited viewpoint, and it's going to be something that was we got to cut through all the bureaucracy and come down to a single point on a single issue. And there's been relatively few of them. But President Obama really likes the concept. He really, I think, likes this kind of top-down, not just on one thing, but on lots of things. Because healthcare is 17% of our economy. We've gone beyond a Ronald Reagan, let's get after this. We've gone to a much bigger, let's take 20% of our economy and start dictating it. Tom Daschle was the person that Obama first put up for Secretary of Human Services, and he wrote the book on how to do this. He said you need to have a czar like Ben Bernanke is for the Federal Reserve. Congress can't touch him. The president appoints him, and then it's hands off, and then that person makes decisions almost independent of public opinion. Now, that was the model that they are doing, and that continues. Someone told me today that Daschle, and so even though he didn't pay his taxes and so therefore didn't get in, hey, he cut his taxes, huh? He just didn't pay them. That said, they would have a background check. That's why Daschle is not currently the secretary, because he didn't pay his taxes. They would have to be appointed by the president and approved by Congress, but once in power would have great power. And when at 3 in the morning, I'm sitting there thinking about this commissar and thinking how much power she or he would have over your business and your life, be able to determine how much you can earn before you get a federal subsidy and how you're going to prove that that's all you earn, you start thinking, man, do I live in the United States of America? So the people that are concerned about their liberty are concerned about the power of folks such as this and their ability to reach into your life to decide what you get, what you deserve, and whether or not you're cheating. Yeah, that's the concern. I'm sorry? They want this to be free of the process because once you... let me be fair to them. Let me be fair to them. Whenever the federal government tries to make some different policy decisions on health care, Congress stops them because special interests can stop it. That's why I don't like anything that comes out of Washington. I like something that comes out of your organic relationship with your physician, that you and your physician help make that decision. Well, the Senate would approve it. The Senate would have to approve this bill. No, but believe me.
I would ask if there's any way to have a rule change or some kind of a procedure in place that says when you vote on a bill, you have to initial every page that you have seen it, you've read it, and you understand it.
That's a great idea. First, let me say, I read this bill, okay? I want you to know that. In fact, I think I'm up to 3 times in some sections because I kept on thinking this can't be true. Secondly, I've also sponsored a bill that would require Congress to let a bill, after it's ready to be voted on, sit for 72 hours. That's not just for Congress, that's for you. This is a participatory democracy. You would log on and you would say, hey, this affects my Medicare Advantage. Hey, what about my policy? This is my situation. And then you would channel that information to me. When Monica asks those questions, those are great questions. Those are better questions than I hear asked in Washington. I need your wisdom. So, secondly, it would sit for 72 hours. But in fairness to my colleagues, when you're given a bill at 3 in the morning and said you're going to vote on it at the noon the next day, and that is 400 pages, 300 to 400 pages, you can't read that bill. You see what I'm saying? No. I'm talking about an amendment to the cap and trade that was given to Republicans at 3 in the morning and we had to vote on the next day. And, I voted no on that, of course. But they had the votes. Yeah. So they've set up the system to block your participation. I've been there for 8 months. And frankly, I grind my teeth at night because I'm sitting there thinking, this is not how we thought this process worked. But it's my commitment to you, however, Ms. Parrish, I can do it, to make this process the way we know it should work and the way that you and I can participate most fully in all those important decisions. So that's again, that is wisdom. The gentleman is saying there's no reason for a bill to be that long. A bill can be that long if you decide you don't want people to completely understand it, and that's part of the problem. Yeah.